Hi, welcome to this presentation. Thank you very much for your attention. My name is Ignacio Jauregui. I work in the Health Informatics Department in Hospital Italiano de Buenos Aires, and I'm going to present the study named Recurrence of Hypoglycemia in Hospitalized Adult Patients in Non-Critical Areas, an opportunity to improve patient care using electronic health records. Hypoglycemia is defined as the value of less than 70 milligrams per deciliter of glucose in patient's blood, and is associated with higher morbidity and mortality. In hospitalized insulinized patients, diabetic patients, the prevalence is around 40% and is associated with longer hospital stays. The causes and predictors of the recurrence of hypoglycemia are quite controversial, and most of the literature is based on critical care patients. In the case of hospitals that count with an EHR with a clinical data repository, allow them to have a real-time glycemic monitoring, to implement clinical decision support systems, to help physicians and practitioners to assess that problem, and to implement standardized guidelines. This could reduce the recurrence events, the recurrence of the hypoglycemia events, and thus improve the quality of care and the safety of the patients. Well, the objective of this study was to estimate the frequency of recurrence of hypoglycemia in hospitalized adult patients in non-critical areas with and without diabetes, and also to explore the factors that were associated with the recurrence of hypoglycemia events in the same population. We performed a cross-sectional study. Our sampling included patients that were admitted in 2017 and 2018, and that had at least one hypoglycemia event defined as less than 70 milligrams per deciliter, both capillary glycemia or serum glycemia, and that were more than 18 years old. Also, that were admitted in not critical areas. We excluded pregnant women, and we performed the study in Hospital Italiano de Buenos Aires. For the collection of the data, we used the secondary use of the clinical data repository, that the data was primarily input by practitioners in our homegrown level 7 MRAM EHR. For the analysis, in the quantitative variables, we took the mean and the standard deviation, or the median and the interquartile range. For categorical variables, we analyzed the absolute and relative frequency, and for the associated factors, we performed a logistic regression and reported the odds ratio. The study was approved by the local IRB committee. Well, we sampled in total 2,299 patients. We excluded a number of them because they were admitted in an intensive care unit or were obstetric patients. So we totally analyzed 1,884 patients, from whom 573 had a recurrence of hypoglycemia event, and 1,311 didn't have a recurrence event. We analyzed the baseline characteristic of these patients in both groups, the total population and the group that had a recurrence hypoglycemia event, and they were comparable in all of the variables we took. As I said, 573 patients had a recurrence hypoglycemia event, so it's a relative frequency of 30%. The mortality was in the general population 18%, and in the recurrence group was 24%. The median length of stay was 10 days in the general population and 15 days in the recurrence group. Well, when we stratify the prevalence of the recurrence of hypoglycemia events by different variables, we can observe that in patients that were more than 60 years, the prevalence was 29%, and for younger patients, less than 60 years, was 32%. The median recurrence glycemia value was 63 milligrams per deciliter. And in the general, in patient with diabetes, this value was 60 milligrams, and without diabetes was 64 milligrams. As I said, we performed a logistic regression to analyze those variables that induced a higher risk of developing a recurrence event. And we found that a number of these variables were significantly associated with the recurrence group. Namely, there were more diabetic patients in the recurrence group, the renal failure, cirrhosis, infections, insulin treatment, corticosteroids treatment, fasting, length of stay, ICU, and mortality in hospital. Well, about the discussion, we can say that the recurrence of hypoglycemia is a frequent problem among patients, non-critical patients that are hospitalized, reaching 30%. That new measures should be developed for the management and prevention of these recurrences. And a number of associated factors were identified, so they can be used for developing these preventive strategies, for example, building some clinical decision support system within the EHR. Some strengths of our study were that it was built with high quality data that was input in the EHR and collected from the clinical data repository that integrated with our laboratory system. And we have semantic interoperability that allow us to understand the different measures that we analyzed, for example, capillary glucose and serum glucose. And some limitations of our study were that because of the cross-sectional design, causality could not be assessed. And also some variables could not be analyzed. For example, the clinical management, the time to recurrence of the hypoglycemia event, and also the causes of the hypoglycemia. We found out that the prevalence of the recurrence was lower than other studies. We think that this could be because of we took general population, and other studies also only included diabetic patients. We also find that the mortality among our population was higher than a previous study made in our institution. We think that this could be due to a different population and more complex patients with worse clinical conditions. And we found that the mortality was higher in the patient that had a recurrence event, 24%, and 16% in the case of the non-recurrence group. This was significantly significant. There are a number of guidelines that said that in the patients that have a hypoglycemic event, the insulin dose should be reduced at least 20%, but this is implemented only in 44% of the patients according to the literature. The spontaneous hypoglycemia is associated with higher mortality, what suggests that the hypoglycemia is more a biomarker of the damage and not the actual cause of the death. So there is a need to stratify the risk of the recurrence of the hypoglycemia in the population and to ensure proper clinical management when the event has succeeded. So there are a number of strategies that could be taken into account, for example, building some clinical decision support systems within the EHR. Some general conclusions. The global prevalence of hypoglycemia recurrence in non-critical hospitalized patients is 30%. And due to its high prevalence, it's important to identify the vulnerable population, to implement preventive measures to assist clinicians in identifying and treatment and the follow-up of this pathology. Thank you very much for your attention and continue to enjoying the conference.